Hello everyone, this is Ramu Vadukapuram, a postdoctoral fellow in the Department of Psychiatry at ICANN School of Medicine at Mount Sinai. Today, I'm going to present a topic entitled Exploring the Common Methods of Suicide and Self-Inflicted Poisoning or Injury by Individuals with Major Depressive Disorder and Bipolar Disorder, a nationwide inpatient sample analysis. Introduction. Suicide affects people of all ages and it is the 10th leading cause of death among all ages. Individuals with psychiatric disorders such as major depressive disorder and bipolar disorder are at increased risk for suicide and estimated to be more than 30 times higher than in the general population. According to World Health Organization, 2 to 15% of patients with major depressive disorder and 3 to 20% of those with bipolar disorder end their life by suicide. We examined the prevalence of different methods of suicide and self-inflicted poisoning or injury in individuals having major depressive disorder and bipolar disorder. Methods. The study used a national inpatient sample dataset from years 2012 to 2015. The National Inpatient Sample is one of the largest inpatient databases from the Healthcare Cost and Utilization Project, which covers 4,411 hospitals in 45 states in the United States. Data on patients over the age of 18 years old admitted for major depressive disorder and bipolar disorder were collected from discharge records. Prevalence of different methods of suicide and self-inflicted poisoning or injury were evaluated among major depressive disorder and bipolar disorder patients. We also investigated prevalence of psychiatric comorbidities among the two groups. Results. We identified 13,556 unweighted records of patients admitted to the hospital for major depressive disorder diagnosis and 6,506 unweighted records of patients admitted to the hospital for bipolar disorder diagnosis. Suicide and self-inflicted poisoning or injury by cutting and piercing instrument was highly prevalent among both groups, with a greater prevalence among patients with bipolar disorder in comparison to major depressive disorder. Tranquilizers or other psychotropic agents and other specified drugs and medicinal substances among both groups were higher, but there was no significant differences between the groups. Analgesics, other sedatives and hypnotics, other and unspecified solid and liquid substances, and hanging by strangulation and suffocation was used more in patients among major depressive disorder group compared to bipolar disorder group. Psychiatric comorbidities. Prevalence of anxiety disorders and adjustment disorders were high in the major depressive disorder group compared to bipolar disorder group. Prevalence of schizophrenia and other psychotic disorders and personality disorders were higher in bipolar disorder patients compared to major depressive disorder patients. Conclusion. Our study results concludes that it is critical to investigate and understand the methods used by individuals with major depressive disorder and bipolar disorder to commit suicide. Restricting access to the most prevalent methods of self-injury could be an effective suicide prevention approach. More future studies are needed to focus on methods of suicide attempt to reduce the risk and provide high-quality care for these vulnerable patient populations. Thank you and have a happy holidays.